Amid the coronavirus pandemic, tribal leaders, health advocates, and Native organizations are putting pressure on the Trump administration and Congress to keep treaty and trust responsibilities to tribes. Across the country, tribes have declared states of emergency due to COVID-19. Most already face chronic federal underfunding for health care, and many tribal community members are among the nation's most vulnerable. The Navajo Nation is struggling to control an outbreak of the disease that's infecting tribal members at rates much higher than the surrounding communities. Here is correspondent Antonia Gonzalez with President Jonathan Nez and Stacy Boland of the National Indian Health Board.
Navajo Nation President Jonathan Nez, thank you for connecting with New Mexico PBS this afternoon.
Hey, Antonia, thank you for having us on the show.
And the Navajo Nation is one of the largest tribes in the United States with the largest land base. You and your administration took COVID-19 information and news serious from the start. As of Thursday, the nation had reported 69 positive cases. What is the biggest challenge right now facing the Navajo Nation?
Well, we have, Antonia, we have a shelter-in-place order throughout the Navajo Nation. So we're wanting all our Navajo members and residents to, stay at home. I think that's the safest place to be here, and also to minimize the spread of COVID-19 coronavirus throughout our Navajo Nation. So right now, the biggest concern that we have is getting the needed equipment to our first responders. And I guess that's like that throughout the country. It's just not Navajo Nation. We're trying to get personal protection equipment to those that are giving out food and necessities to our most vulnerable, which are our elders and our those that are being cared for by healthcare providers. And so we're just trying to do with what we have. And we did get some equipment from the Strategic National Stockpile that's coming into the states and coming up into the Navajo Nation. So we appreciate that resource coming in. But, some of the resources from the federal government has yet to reach Indian country and has yet to reach the Navajo Nation. And, that first allocation of dollars, that $8.3 billion, and out of that 8.3, 40 million went to the tribes. To this day, Antonia, we haven't get one penny of that. And there's just so many hurdles. And I just saw the CDC, that $40 million CDC is saying, the federal government is saying is you got to apply for it as a grant. And we have to do all the paperwork, and the grant application deadline is in the next week or 2 weeks. I don't quite remember, but we have to wait for that deadline before we even get any of those dollars to the Navajo Nation. But yet that first 8.3 billion, a lot of that money has gone to states directly, and yet tribes have to apply for that, and as a pass through the CDC or pass through the states. And it's frustrating. But I just want everyone to understand that there's no difference here. Even the funds that we get from various federal allocations have to go through the states or the programs and departments of the federal government before it comes to tribes. So that needs to be reevaluated, and I'm hopeful that our congressional leaders are listening, and those changes need to happen. We need those resources immediately into Indian country and here on the Navajo Nation.
And as you're urging Navajo citizens to stay home, to limit the spread of COVID-19, there's a lot of people in the public who are interested in even helping the Navajo Nation. You've closed all the tourist areas, and you've asked tourists and people who are not, from the Navajo Nation just to not visit at this time. What's your message to the public outside of Navajo land?
Well, we appreciate all our visitors every year coming to the Navajo Nation to, experience Navajo people's culture, tradition, and their way of life. And throughout the world today, right now, and throughout the country, it's really no time to be traveling. And we're just asking our visitors to please respect the sovereignty of our Navajo Nation, and where we closed all our tourism destinations or point of interest throughout our nation. And right now there's an emergency clear across the country, and to limit the spread of COVID-19 everywhere, the best place to be is to be at home. And we just ask our visitors to, respect our laws and our authorities here on the Navajo Nation. So, we say that with all due respect.
We want to bring in Stacy Bolin with the National Indian Health Board. Stacy, your organization has been involved in national discussions about tribes and COVID-19 and also conducted a recent survey. What are you hearing is most important for American Indians and Alaska Natives?
Right now, we've heard that there is very little access to personal protective equipment. The N95 masks, gowns, gloves, ventilators for treatment. And that's one of the top things that we're hearing.
And can you talk a little bit about how rural American Indian and Alaska Native communities are being hit?
You mean in terms of the incidence and prevalence of the disease?
Just as far as what we know when it comes to health disparities among tribes in the country and looking at different diseases in the past, what may happen to tribes that don't have access to hospitals or have limited healthcare services?
Well, in this particular disease process, what is really frightening is that the top indicators for vulnerabilities to COVID-19 also happen to be the top health disparities of Indian country. For example, the presence of diabetes is always listed as number one for a vulnerability for COVID-19. And then respiratory illness, we understand, of course, that tuberculosis rates in Indian country are hundreds of times higher than anywhere else in America. Cardiovascular disease, hypertension, all of the things that Indian country has as their top, our top health disparities. And when you align that with the exact vulnerabilities that COVID-19 creates, it's really a deadly combination for the tribes. Then you have a health system that is grossly under-resourced and always has been. And you have a situation where the hospitals in Indian country are 40 years old and older, where mainstream hospitals are not older than 10 years old. Only half of the IHS tribal facilities have surgical capabilities and very little intensive care capabilities. So add on to that the requirement that social distancing occur. How do you socially distance when you have multi-generational families living together in a home? Because that's traditionally what we will do. Social distancing is not a native value, but it's something we have to adapt to for the time being until this is behind us. Another something else specific to Indian country is when you hear CDC and others repeatedly say, wash your hands, wash your hands, wash your hands. Well, what if you don't have access to clean, safe running water or sanitation facilities, as is true among some of the tribes in New Mexico, certainly in Alaska, Montana, other places in the country. So yes, Indian country does specifically have some very strong vulnerabilities that create almost a perfect storm for this to be devastating to our people.
So do tribes feel like they are prepared for COVID-19?
No, I don't think so. In the conversations that we have with tribes, of course, the National Indian Health Board serves all 574 federally recognized tribes in the United States, both American Indian and Alaska Native. And we are in constant communication with people all over the country in Indian country. Tribes do not feel prepared. And tribes are being very creative with how they'd like to be prepared. We just had a board call, and one of our members from Lummi Nation, who they have just found their 10th person suffering from COVID-19. They want to build an emergency medical facility. They need help to do that.
And can you talk a little bit about the push by tribal leaders, health advocates, national Native organizations to keep pressure on the Trump administration and Congress to make sure that discussions about COVID-19 and funding include tribal nations?
Yes, well, we've been very strongly advocating around the clock for the last 3 weeks since this became an apparent crisis waiting to happen, and frankly, waiting hours, not days to happen by the time we really realized how bad this would be. We started advocating almost immediately around the 1st of March to have Congress pay attention to the special and unique circumstances of tribes and to remind Congress of the trust responsibility that exists between the federal government and tribal nations. And, we have a lot of friends in Congress. Many of them are in New Mexico. We had several victories in these last 3 supplemental bills. One that is pending now would bring $1.032 billion into the Indian health system. There would be another $125 million set aside for tribes in the CDC and $15 million in the Substance Abuse and Mental Health Services Administration and the Health Resources and Services Administration. So there are substantial investments just in those columns alone for Indian country. That's the bill that's pending right now.
Thank you. Stacy Bolin with the National Indian Health Board.